Hello and welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host is with me.
Hey guys, my name is Faraday Golembieski, and I am a board certified family nurse practitioner at RevitalyzeMD.
So today we are going to talk about Peyronies and all things Peyronies. So it'll be a very good episode, but I want to stop first and say there are lots of viewers that aren't yet subscribers. So if you like the content we're putting out, please subscribe, hit the subscribe button because that really helps the channel. So let's get into it. So what is Peyronie's disease? What's the incidence of Peyronies? How is it typically treated? So first off, what is Peyronies? So it is a scar tissue inside the penis that is typically causing a curvature that worsens with time.
And that curvature can cause pain with erection or with intercourse, and it does worsen over time in most cases.
Yes. And so, what are the causes? Like, why did it happen? Because a lot of men will report nothing significant as the cause. So, they don't recall anything in particular, but it can be trauma. So, if you think of even Foley, placement potentially, or trauma, or vigorous sexual activity, and the most common position for that, because we did a fun podcast on that.
We did. We sure did.
Do you remember
I believe, was it reverse cowgirl?
Yeah,
I believe that's what
yes.
it was, if I remember
Yeah.
correctly. I remember it was the female on top, but I couldn't
Yeah.
remember
That
which
was the
one.
most, that was the position that most frequently will cause any kind of injury, penile fractures, or potentially just an injury such as this that can therefore cause a scar tissue. And in an acute phase, that's more of an inflammatory phase. And so that scar tissue is going to be inflamed. There's acute inflammation going on. And then over time, as with all inflammation, especially and soft tissue in the penis, with this would be included, is just it becomes a more fibrous issue and is no longer acutely inflammatory. And so that matters when it comes to the traditional treatment options
And what your
that are
treatment
available.
options are. Yeah.
Yeah. Yeah. So basically the incidence is reported to up to 10% of men will
And typically in
experience
men
that.
over the age of 50.
Yes, more common with age for sure. And if you think about again what it causes, so curvature, but can also cause pain with erections and even ED progressively,
Mhm.
because it does progress with time. So erectile issues, not just pain with erections, but erection issues.
Well, if you're having a ton of pain,
Yeah,
typically
yeah.
that's enough to kill the erection.
Yes, true. But it also, and one thing that they don't mention, but we hear in the office all the time, is the pain and discomfort with the partner. And so it's not something they talk about because when you're looking at guidelines for this or studies, it's all studying the man and the condition. But the real life component of that is that women will have pain with that as well and discomfort from a curvature. And so it affects the partner and the relationship.
So, what can we do about it, Dr. Durst? What are the
Well,
treatments? What's available?
exactly. So there's only one FDA approved treatment for this, and that is an injectable Xyloflex, which is a collagenase Clostridium histo historicum.
There you go. Go for it. I was going to let you do
Histolyticum.
all that.
Sorry, just at the last minute, but it's an HCC. It's a long word, but Xiaflex is otherwise. It's a brand name Xiaflex, but that's what most people know is because that is an easier thing to say, obviously.
And as
And so,
Dr.
what
Durst
does that
said,
do?
yep, I'm going to say, and as Dr. Durst said, when she was explaining the difference between inflammation and fibrous tissue building, is because this is a medication that's FDA approved and recommended in stable Peyronies. That means it is the chronic phase. It is not that initial phase where we have some inflammation and just starting to have some curvature.
Collagenase Clostridium histolyticum is the actual official long name, just to say it, just to put it out there. But basically, yes, Faraday is correct that that is for the chronic phase. So after the acute phase of that, that you can use this and inject it potentially to break up and to basically dissolve the collagen in that scar tissue.
Yeah, that collagen within that plaque to help dissolve it.
Correct. And so approximately studies maybe 32 to 34%. Some reported maybe up to 38% improvement in the curvature.
And the placebo was right around 18. So some improvement, but at least it's something when there are very few options.
Correct. There is a quite a bit of satisfaction with the procedure. So reported about 70% satisfaction. So maybe in the 30s, like a third of improvement in curvature, about 70% of men are satisfied with it. And most of the reactions to it, the side effects are mild and transient, such as
Bruising at the site.
swelling, just a little bit of discomfort.
But then the one big one, the one big adverse effect, but it's not widely seen. But
1% of men can experience penile fracture. And so it can weaken, not only just break down the tissue there, but could potentially weaken the tissue in that area. And so then you have an increased risk of penile fracture with it. So, and again, across the board, it says a 70% satisfaction rate. I don't know how commonly it's done. We have seen a lot of Peyronies patients, but not one of them has opted for surgical or injectable FDA treatment of it.
I was going
Not
to
one.
say, we don't really see patients on this medication at all.
No.
And that is the urological guidelines first line treatment. So I find that very, very interesting that
Yes.
they're not coming to us on a medication.
So we would love to get feedback. So definitely give us feedback if you are watching this and you have sought treatment, what you've done, and has anyone used or been treated with Xiaflex? Because again, we're not seeing in general all the Peyronies patients coming to us, but we are seeing the ones that have chosen not to do
Surgery, usually.
surgery or any injectable. And so I have not firsthand had anyone share their experience with Xiaflex with us. So we would love to hear from you. So the other treatment options are all non-FDA approved, but some of them, importantly, do not involve medications or surgery. And so
Yes.
that's where we come into play. So vacuum erection devices are awesome for this. And so we've done a podcast on that before and talked about vacuum erection devices, but that is basically a penis pump. So that has a great improvement in Peyronie's disease and not
Yeah.
surgical, no side effects.
Exactly. And the Urological Association does recommend traction as an adjunct therapy.
Yeah. So some penile traction or PE, otherwise known as PE, and we've talked about that as well in a previous podcast. And so those are the two FDA treatments, but also non-surgical treatments. And so, but not FDA approved. So not addressed, but those are not surgical, not medicine, and no side effects and things that men can do on their own. So good viable options. And then there's some other that are still not FDA approved, but medications
That are
if we wanted
off-label.
to talk about. Yeah.
Like verapamil is an off-label use.
That you can inject, and there's also a topical version of that. Pentoxifylline is another one that you could potentially use. Again, I've not heard of anyone using any of these from a urologic standpoint or from a patient standpoint. So let us know. Again, we want to hear from you.
It's interesting to see things on guidelines like this that we don't see in practice. So we'd love to hear your feedback.
And having said that, we do a lot of emerging therapies, which we'll talk about next as treatment options. And so they usually don't involve medications and surgery. So they're not frequently on guidelines, but patients are looking for that kind of solution. And so the new and emerging treatments, such as PRP and even an acoustic shockwave therapy, and both of those can be used to treat Peyronie's disease and quite effectively as well.
And they are listed in the guidelines as well, just not discussed often with patients. So typically the patients we see in office are the ones that said, hey, I was told there are no options but surgery, but I came across a blog or your website or a friend referred me here to see what other alternative options there are.
So they are on the guidelines. You say
But they
that,
are in the guidelines, but they're
but
not
it's
being offered.
emerging therapies on the guidelines, PRP injections, which is again platelet rich plasma, drawing your blood, taking it, spinning it down, and getting the platelets, which have growth factors in them, and re-injecting them into the tissue to get improved blood flow and regeneration and even sensitivity, but we can also inject it into the plaque, which helps with that remodeling of collagen. And then the acoustic shock wave is something that we can also concentrate on the plaque for improved alignment and remodeling of that
Yeah.
collagen with great results as well.
And decreased pain.
Yes. And so, but those guidelines were 2015. The
Yeah.
most recent updates were 2015, and you found like an educational internal
Update in
update.
2022, but I haven't seen anything really in the guidelines to shift anything significantly from that update.
Yes,
So it'll
correct.
be interesting to see. I believe it said it was updated educationally in 2022, available for review in 23. We're going into 25. It would be nice to see those further updated with some support.
Correct. So emerging therapies with an updated guideline of 2015, maybe it's time to look at those
Yeah.
emerging therapies again and what studies support. And we have done lots of videos and podcasts on that, including studies. With those, but not specifically related to Peyronies. So forums are an important way to find information. So if you have a curvature, to just knowing that curvature, the terminology medically speaking is Peyronie's disease. There's forums with that talk about acoustic shockwave, PRP, and how effective. But you also get people on there and men on there talking about these FDA, like an FDA approved treatment of Xiaflex, and see what they say.
And then you
And
get guys talking about surgery. We haven't even talked about the surgical recommendations.
oh, yes. Well, and there you go. So it's medications, injectable, FDA approved, and then surgeries as a last resort. And I'll let you discuss a couple different options, which don't sound very
Yeah, they don't
appealing.
sound super great. Implants, so there's prosthetics, so that's more of the severe option
And
where they place an implant.
an excision, like you can actually take out the scar. And there's another one, plication, which you can actually just shorten. So again, if you're shortening the penis or you're taking out the scar, potentially you are shortening and decreasing the size of the penis. So it doesn't
And then
sound very
increased
appealing.
risk of ED. So
Yes.
erectile dysfunction. So both of those have an increased risk of erectile dysfunction, and that's why they have the prosthetic option. So if
Correct.
you have severe curvature, you failed the one or both of those surgical options, you can use a prosthetic to get function back.
Yeah.
But that is really the end all be all last option available.
So the bottom line is first line therapy, FDA approved, is Xiaflex with, again, not, I just don't know how frequently that is used. And the forums such as Reddit or just, Facebook forums, Reddit being a good one. There's actually on the Dr. Runnels Cellular Medicine Association, if you look at the official P shot, there'll be a forum for Peyronies. So injectable would be one, and then surgery if you fail it, with lots of off-label and emerging therapies. But our issue is that we love the emerging therapies because they're regenerative. They're not medicines. They're not surgery.
We're not cutting.
We're not cutting. And anytime you cut, you potentially have risk of ED or affecting tissue function,
Sensitivity,
Yeah.
all of it.
So I would just consider, if you have Peyronie's at curvature, at least know what it's named, and then those therapies that I'd look to forums, but then look for regenerative therapies such as PRP, injections, and acoustic shockwave
And
as
if
a
you have
potential.
Peyronies or your partner has Peyronies and you want more information, we'll be doing podcasts that are very specific to some of these treatments. So keep an eye out for those as well.
All right. Well, drop your comments. I look forward to hearing them with this. We want to know your experience. So thank you for tuning in. Don't forget to subscribe and let us know because we're willing to deep dive into anything wellness and sexual wellness.